Complications occurring during the labor process are emergent and require immediate intervention in order to improve maternal and fetal outcomes. Labor dystocia or dysfunctional labor is a difficult or abnormal labor related to the 5 P's: passage, passenger, powers, position, or psychological response. Risk factors include maternal pelvis size or shape, a macrosomic or large fetus, abnormal fetal presentation, ineffective contractions, or ineffective maternal pushing effort normally related to fatigue or fear. Expected findings for labor dystocia include failure to progress, which happens when the cervix is no longer dilating, failure of the fetus to descend, which happens when the fetus remains in a high station, a hypotonic uterus, which is a weak, inefficient uterus with absent contractions, or a hypertonic uterus, which is excessively frequent contractions with strong intensity and inadequate uterine relaxation. Our nursing interventions will include maternal position changes, using sacral counterpressure by using the heel of your hand to apply pressure to the sacral area to alleviate discomfort, anticipate an operative delivery with forceps, a vacuum, or a cesarean delivery. If the uterus is hypertonic, then the nurse can administer ordered analgesics to help with client's pain and medications like terbutaline to slow uterine contractions. For a hypotonic uterus, the nurse can administer Pitocin IV to augment and strengthen the uterine contractions. A prolapsed umbilical cord occurs when the umbilical cord is displaced and comes before the presenting part of the fetus, or when the umbilical cord protrudes through the cervix, causing cord compression and compromised fetal circulation. The number one risk factor is a spontaneous rupture of membranes. Other risk factors include high fetal station, fetal malpresentation, such as breech or transverse lie, a fetus that is SGA, small for gestational age, or hydromenos, which is an abnormally large amount of amniotic fluid. The nurse's priority is to assess the fetal heart rate after a spontaneous rupture of membrane. If the nurse observes a prolonged deceleration after a rupture of membrane, this is a sign, a positive assessment finding of a prolapsed umbilical cord. A prolonged deceleration is a fetal heart rate that is 15 beats per minute or more below the baseline and lasts at least 2 minutes but less than 10 minutes. Another assessment finding indicative of a prolapsed umbilical cord is palpation or visualization of the umbilical cord protruding into the vaginal canal or from the vaginal opening. Nursing care for a client with a prolapsed umbilical cord starts with calling for help. This is an emergent situation. Other nursing care is aimed at trying to lift the fetus off the umbilical cord and oxygenate the fetus. The client needs to be placed in the Trendelenburg position with her hips higher than her head. With a gloved hand, insert 2 fingers into the vagina and apply pressure on either side of the cord to lift the fetus off the cord. Administer oxygen to the client and transport the client to the OR for an emergent cesarean section. Another complication of labor is a uterine rupture. A uterine rupture happens when the muscular wall of the uterus tears. This is a rare and life-threatening obstetric emergency. Risk factors that can cause a uterine rupture include trauma, like a fall or motor vehicle accident, prior cesarean section, overdistension of the uterus related to a large macrosomic fetus or multifetal gestation, hypertonic contractions, forceps-assisted birth, or multigravid clients. When a client experiences a uterine rupture, they will report a sharp abdominal pain with overall uterine tenderness. The nurse may assess a change in uterine shape, sensation, or complete stop of contractions, a non-reassuring fetal heart rate patterns such as bradycardia, variable or late decelerations, or abnormal and minimal variability. A uterine rupture is an emergency and requires a cesarean section. Nursing care involves preparing the client for a C-section by administering IV fluids and oxygen, as well as administering a blood transfusion due to the large amount of blood loss. Other complications that can occur during labor include meconium-stained amniotic fluid, precipitous labor, and an amniotic fluid embolism. Meconium-stained fluid happens when a fetus loses control of the anal sphincter, allowing meconium to pass into the amniotic fluid. This is normally a sign of fetal distress and fetal hypoxia when variable or late decels are present. The meconium-stained fluid enters the fetus's lungs and can cause breathing issues and infection after birth. A precipitous labor is a very quick labor lasting 3 hours or less from the onset of contractions to the time of delivery. An amniotic fluid embolism can occur when amniotic fluid enters the maternal circulation. This complication causes respiratory distress and circulatory collapse in the mother. In summary, complications occurring during the labor process are emergent and require immediate intervention. The most common labor complications include labor dystocia, prolapsed umbilical cord, uterine rupture, meconium-stained fluid, precipitous labor, and an amniotic fluid embolism. The labor nurse needs to be aware of the risk factors associated with these most common labor complications, expected assessment findings, and required nursing care to prevent maternal and fetal morbidity and mortality.